Assalamu alaikum. Pharmaceutical jurisprudence, very important questions with answers, notes for you for the diploma in pharmacy second year students. Part 2. Simply. See, important questions and answers. I am giving you very important questions, and this video will be divided in the parts. Part 1, Part 2, Part 3, and Part 4. Maybe very important questions. Inshallah, I will provide you. So please don't skip this video. Watch the video until last. And one request to you all, if you are new to this channel, subscribe my channel Legend Pharmacy and turn all the bell icon. Notification is there now. You have to turn all that. That is mandatory because now see, part 1 I had uploaded now after, but tomorrow inshallah I will upload part 2 and part 3. Now what you are unable to get that part 2 and part 3. Part 2 and part 3 also very important one. Okay, why? Because they also store some of the important question and answers. If you study only this one, means maybe you will fail in the examination. So please, my request to you all, observe all the parts of the particular subject. Already I have uploaded pharmaceutical chemistry 2, I have uploaded pharmacology and toxicology, I had uploaded pharmaceutical chemistry 2 also I had uploaded, my dear brothers and sisters. Go and view that link, go and view that video. Really it is amazing and fantastic. Yes sir. First question, state the objectives of Pharmacy Act 1948. See, very simple. In pharmaceutical jurisprudence we will study here about the rules and regulations of the pharmacy. Okay, what are the rules and regulation, acts in the according to Pharmacy Council of India, and some relating to the doses. See, objectives of Pharmacy Act 1948: to regulate the profession and practice of the pharmacy and to raise the status of pharmacy in India. What's the main objective of this Pharmacy Act? Means to raise the pharmacy status of in India. Okay, then constitution of PCI, Pharmacy Council of India, responsible for evolving educational standards and regulations for the course in pharmacy through education regulations. Okay, constitution of Pharmacy Council of India, they are responsible for evaluating this educational standards. They are giving good standard qualification educations. Then the constitution of State Pharmacy Council, State Pharmacy. Now for an example, see here PCI, it is whole belongs to center India, Pharmacy Council of India. Now state is, for an example, you are doing your pharmacy in Karnataka. Okay, that is the State Pharmacy Council of India for registration of pharmacists and for regulating their professional activities. These are very, very important for Regulation Act, okay, for the pharmacy of 1948. Next question, repeatedly asked in our examination. See, these all questions and answers I have collected from the question papers only. Yes, second one, explain the functions of Pharmacy Council of India. Very simple function: to prescribe minimum standards of educational required for qualifications as a pharmacist. Minimum standards of educational required for qualification as a pharmacist. Every year you are noticing that every year many pharmacists pass out. Many pharmacists get these qualification certificates. To regulate minimum educational standards. Then to recognize a qualification granted outside the territories to which Pharmacy Act 1948 extends for the purpose of qualifying for registration under the Pharmacy Act, said Act. To compile and maintain a central register. These are also a function of the PCI. Then control over institutes if violated. If any institute violated, these PCI having the rule to control them. Okay, then approving institutes that conduct pharmacy courses, all other functions that may be assigned for the implementation of the act. See, these are the functions. See, this subject is history. Just we are here by hearting, remembering the points, and very easy points. Very easy subject this one. Discuss the silent aspects of the Poison Act 1919. See, penalty for unlawfully import, possession for sale of any poison, unlawful possession to keep poison, importation without license, breach of conditions, means condition of license. There will be punishable acts like imprisonment, jail for 3 months, or fine for 500, or both on first convention. You will get both 3 months of jail and also 500 rupees fine. Then imprisonment, 6 months fine, and also 1000 rupees fine on both on second or a subsequent conviction. Poison along with the vessel is confiscated, means seized. All these gadgets what you are carrying, that all are seized according to Pharmacy Council of India. that is Poison Act. Then explain the circumstance under the which pregnancy may be terminated, which In which condition the pregnancy can be terminated? See, pregnancy is not more than 12 weeks old. Okay, means circumstances for termination of the pregnancy by RMP, registered medicinal practitioner, is very important here. Pregnancy is not more than 12 weeks old. It should not go beyond 12 weeks old. Means approximately 3 months. Okay, inside the 3 months only, according to this PCI, means Pharmacy Control Act, Pregnancy Control Act, the RMP practitioner can give a circumstance for which pregnancy, termination of the pregnancy. Serious injury to physical or mental health of the woman. When this termination of pregnancy can be carried only when the serious physical or mental health of the woman, when child to be born would be seriously handicapped. Okay, more than 12 weeks but less than 20 weeks. Now conditions, more than 12 weeks but less than, it should be within 20 weeks. If pregnancy caused because of rape or as a result of failure of any contraceptive devices used by the married woman and her husband for the purpose of family planning, it may presumed to constitute a grave injury to the mental health of pregnant women. Very simple. If by using some of the contraceptives, if that woman is having any grave injury on the brain or any part of the physical body, then what happens? At that condition, less than 20 weeks of the pregnant woman can be terminated according to the Pregnancy Act. Yes, so now the sixth very important fifth question: what classes of drugs are prohibited from import to India? Some of the drugs are there that are prohibited. Classes of drugs prohibited to India. No, one is not of standard quality. If the drug is not in standard quality, then that drug is prohibited. The next one is misbranded drugs or misbranded cosmetics, adulterated drugs, medicines whose label doesn't bear true formula, drugs which shows severe or high side effects, drugs whose manufacturer sale distribution are prohibited in original country. Means for an example, in Afghanistan, if that drug is prohibited, means you cannot import the drug in India. Then expect for the purpose of a test examination and analysis. Some drugs from the other countries are carried or occupied for the test. Okay, that is a little bit works, but not the person, normal person, we cannot import the drugs. Then expired drugs, scheduled J drugs, okay, that also we cannot receive from there. Next, explain the following schedule: Schedule H, Schedule P, Schedule S, Schedule X drug. Schedule H drug, these are the drugs which cannot be purchased over the counter without the prescription of the qualified doctor. Yes, then Schedule P, it stores information about the life period of the drug. Means expiry date all contains on the Schedule P file. Then Schedule SC lists various cosmetics and toiletries and directs the manufacturer of cosmetics to conform to the latest Bureau of India standards requirements. Okay, this schedule S, what it will give advice to the manufacturer of cosmetic and toiletries to keep under the latest Bureau of Indian standards requirement. Okay, he should keep that latest standards of the Bureau of Indian standard requirements. Then he has to manufacture the respective cosmetics and toiletries. Then Schedule X, narcotic and psychotropic drugs which cause delusions, hallucinations and sedations. Okay, these are prescription required drugs by registered RMP. Okay, medicinal practitioner. Yes, these are the very important 6 questions in this part 1. Inshallah soon I will upload part 2.